It's 3 a.m. You're staring at the monitor, and your heart is racing. Is this just a sleep regression because they're learning to walk, or is that repetitive rocking a sign of something more? When you're sleep deprived, every red flag feels like a siren. Today, we're going to clear the fog and look at the clinical differences between a temporary sleep phase and the early signs of autism in toddlers. Welcome back to 3 Koi Fishes. I'm Joy, and here on this channel, our team of parents uses over 80 years of collective experience to help you navigate the hardest parts of raising humans. If you're a mom in that 25 to 44 window, you've likely been told that sleep regressions are just a part of the job. But for many of you, especially our viewers in the US, India, and the Philippines who have been asking about autism red flags, the worry doesn't stop when the sun comes up. Today, we're providing a practical, anxiety-relieving guide on how to differentiate between normal developmental leaps and the early markers of neurodivergence in children aged 0 to 2. A sleep regression is a temporary period, usually 2 to 4 weeks, where a baby who is sleeping well suddenly wakes up frequently or resists naps. Why does this happen? It's almost always tied to a physical or cognitive milestone. At 4 months, their sleep architecture changes. At 9 months, they're learning to crawl or pull up. At 18 months, it's often language explosion and separation anxiety. The key indicator of a normal regression is consistency across environments. If your child is fussy at night but still making eye contact, pointing at airplanes in the sky, and responding to their name during the day, your sleep problem is likely just that. A sleep problem. Now, let's talk about autism-related sleep patterns. Research shows that up to 80% of children on the spectrum have sleep challenges, but the quality of the wakefulness is often different. We will cover 3 main ones. 1. The need for stimulation. During a regression, a baby wants you. They want comfort. In some autistic toddlers, you might notice they wake up and seem perfectly content to stay awake for 2 hours, performing repetitive motions, like flicking their fingers or rocking, without seeking your engagement. 2. Sensory overload. Is the regression actually a reaction to the environment? Autistic children may have heightened sensitivity, that white noise machine you bought to help them sleep. For a neurodivergent child, it might sound like a jet engine, keeping them in a state of hyperarousal. 3. Difficulty transitioning. Autism involves a preference for sameness. If the bedtime routine changes even slightly, the resulting meltdown isn't just toddler attitude, it's a neurological struggle to transition from wake to sleep. The best way to differentiate is to look at the daytime context. Ask yourself these 3 questions. Question 1. The name response. During this regression, is your child still responding to their name? Most toddlers in a sleep leap are cranky, but they remain socially connected. Question 2. Joint attention. Does your child look at what you're pointing at? If they are losing sleep and losing interest in sharing experiences with you, that warrants a conversation with a pediatrician. Question 3. Use of gestures. By 12 to 15 months, we want to see pointing and waving. If the sleep disruption is paired with a plateau or regression in communication skills, it's time to look closer. If you are seeing a regression that has lasted longer than 6 weeks, or if the sleep issues are accompanied by a loss of previously held skills, like words they used to say, "Don't wait," early intervention is the greatest gift you can give your child. It isn't about a label. It's about getting them the right support for their specific brain type. We've seen thousands of parents in our community go through this, and the ones who find peace are the ones who move from worrying to acting. Sleep deprivation makes everything look like a crisis, but you know your child better than anyone. If your gut is telling you this is more than just an 18-month sleep leap, trust it. If this video helped lower your heart rate today, please hit the like button. It helps other tired moms find this information. Subscribe to 3 Koi Fishes to join our community of experienced parents. And in the comments, let me know, how old is your little one, and what is the #1 thing keeping you up at night? We read every single one. Sleep well, or at least sleep soon. We'll see you in the next video.